Good morning, Yasmine Sherriff. Thank you for joining Yellow Shelf. Welcome.
Thank you so much, Joe, for having me today. So, yeah, it's
Ah,
exciting. I've actually never been interviewed, so it's a bit different being the interviewee, I guess.
the interviewee for me, there's nothing worse. So, hey, I'm gonna dive right in. We have a mutual connection who connected us, and I love your niche podcast. Congratulations. Tell us all about NP in Progress, your podcast. What's it all about? Tell us everything.
Yeah, so I'm currently undertaking my Masters of Nurse Practitioners, and it's a big jump from being a registered nurse to being a clinician. So, if you don't know anything about being a nurse practitioner, what a nurse practitioner is, lots of people think it's a student nurse that's just about to finish their training. And I guess that's, like humbling, but also, we're at the top of our level and it's the highest clinical position you can. So essentially, we can see and treat patients, order tests, interpret them, and prescribe scripts, kind of like a doctor, but we're coming at it from a nursing perspective. So we've had years of experience, lots of holistic care we've provided for patients. And I think that that's what nurse practitioners are really strong at doing. And so yeah, like the journey was super intense when I first started my degree, and there's something called clinical reasoning and how you assess and see a patient and make a diagnosis, and that's very different to what we do as nurses. We're very pattern recognition and churn through the sheer volume of patients and not kind of get weighed down by the nitty gritty of making a diagnosis, because we both have, from medicine and nurse practitioners, clinicians, their role is very different to us, to nurses, similar but different. And so that journey was very challenging for me. So I kind of didn't understand exactly what it was at the end of my first semester. So I decided to listen to some podcasts to understand what clinical reasoning was and how to make a diagnosis. And I found no nurse practitioners. So I found this amazing doctor, Dr. Nicola Cooper, on another podcast, and she kind of changed my whole career, I guess, of learning. And there's different ways to learn. And then I tried to look for nurse practitioners, and essentially there was none on clinical reasoning. So I decided to start one myself. And I think we're up to 20 episodes now in 24 countries. And I guess it was about clinical reasoning, but now it's about, the niches of nurse practitioners all around Australia, what they do, the holistic care, the health literacy needs of the Australian population. And it's just connecting me to such amazing, not only nurse practitioners, but doctors and pharmacists. And yeah, it's been amazing actually. And, people over Australia are listening. They email me or, inbox me on my Instagram or TikTok, and they're like, oh, this is so good. Like, you've changed, my path, and
Yeah.
like so incredible. A lot of, like, all of my people that I've had on the podcast are amazing. They have their own little niche that, for me, I learn all the time interviewing people. But yeah, it's great that other people are getting that as well.
Yeah, and the thing I was thinking when I was referred to podcast and I was listening to several episodes, you support curious, emerging, current practitioners. You also like inform family members. Like I didn't really know what a nurse practitioner was. And I guess it gives you more insight into when, you have a loved one in care and what that involves. So it's super informative. And I love that your aim of this podcast is really to build skills and confidence. That's so powerful.
Yeah, so students feel like they're an imposter. Medicine, their doctors are supported for 10 years usually before they get to be by themselves. And nurse practitioners are coming at it with years and years of experience and a 2-year master's degree, 300 hours of clinical placement, and away you go. You're kind of unsupervised. And yeah, it's pretty scary and you feel like a bit of an imposter. And so hopefully people can understand that everyone feels the same way and talking about it. Sometimes I feel like it's a bit of a secret society, nurse practitioners, which, I don't think it is like that. I think nurses are just really good at, getting on with the job and not trying to promote themselves.
Yeah.
That's not really what nurses do. And I think they are the most trusted profession. And maybe that's the reason why, is because they don't talk about themselves or promote. And so my podcast is really letting people know that it's okay to feel that way and everyone feels the same, and some tips and tricks to get through it. So yeah.
Yeah. Yeah, look, you mentioned 20 episodes, and it is a wonderful resource. I'm going to throw a question out there about you as a podcaster. So you've got the skill set of, nursing journey, masters, and then you dive into podcasting. What was that like?
Look, I had no idea how to podcast. So I had to Google and YouTube. I started about 4 years ago,
Yeah.
an education platform for my colleagues in the emergency department. I worked, well, I still currently work in, and it was an audio so people could just tune in whenever they liked. So I kind of had an idea of how to do that, but getting it out onto a podcast and making my tile and my theme song and my intro and making sure that, I'm saying all the right things and, no one's going to sue me or
Yeah.
whatever. It's like a lot to get
Yeah.
through, right?
Yep.
Mm.
And look, it's like you're the double threat. You're a nurse and you're that journey, but you're also this creative. So well done.
Oh, thank you. Yeah, it's so much more than I imagined. So
Yeah.
yeah, I'm pretty happy about it. Not that it's me. I feel like it's my guests that really make
Yeah.
the episodes. So I just interview them, ask questions like yourself. So it's kind of weird sitting on the other side.
Yeah, awesome. And Yasmin, tell us if we're curious about you. You mentioned TikTok, Instagram. If we're curious to connect with you and the podcast, point us in the right direction.
Yeah, so it's on Apple Podcasts, Spotify. I do have some video YouTubes, but not all of them have that. TikTok, NP in Progress, Instagram, NP in Progress podcast. Yeah, so you're welcome to touch base and
Yeah,
happy to help if I can. Or yeah, if you think that you know a presenter that
yeah.
you think would be really good, just flick me, social, and I'll reply.
Yeah, Yasmin, I'll put your contact details in my show notes to make it easy. Thank you so much for sharing. I love niche podcasts, and yours is like the perfect example of that. Thank you so much, Yasmin.
Thanks so much, Joe. Awesome what you're doing. Like I love it. Like 10-minute, 15-minute podcast. It's so good.
It's fun, isn't it? And you get to
Yeah.
share with the global audience.
Yeah.
Yasmin, all the best.
Thank you so much.
Cheers.